Hello, and how are you? Welcome to this session on palliative care. This is our first video, and therefore, we are going to check on the concepts, terms, and related terminologies that contribute to the palliative care. My name is Winnie Barawa, and if you're new here, this is a channel that focuses on lectures, lessons, and expert interviews related to healthcare. If this is your area of interest, remember to give us a subscribe and also click on the notification button so that you can be notified when we post our next class. So for now, stay all the way with us. So in this class on palliative care, we're going to discuss a variety of topics, and the starting point will be on the concept. So in the concepts, let's check what is key that you need to understand as you dwell into the area of palliative care. It's a new area, or rather it's an existing area all the way since history, but the number of specialists is very low, or rather the embracing of this genre has not yet been embraced by so many medics. So this is an area you can think about, go specialize in, and see what the world holds for you. So on the concept of palliative care, by origin, we're told that the word palliation has a Latin origin from the word palliare, which meant to cloak, deceive, or to cover. And so palliate was supposed to mean to lessen or mitigate without curing. So the word palliative care was first coined in 1974 by Dr. Balfour Mount, and this word was now the beginning of more inputs into the palliation care or palliative care, and the growth of it into now more specialized area of caregiving, and more specialists coming in to input their growth, research, and evidence regarding to it. So looking at the first concept, what we call now palliative care. So using the definition by WHO or World Health Organization, it defines palliative care as an interdisciplinary medical caregiving approach that improves the quality of care of patients and families facing problems that are associated with life-threatening illnesses through prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, which could be physical, psychological, and spiritual. So WHO recognizes that palliative care is a specialized, actually interdisciplinary medical caregiving approach. And what it does is it improves the quality of life of patients and their family who are facing life-threatening illnesses. And how are they going to take care of this patient is by preventing and relieving the suffering of this patient, by ensuring that there is early identification and impeccable assessment and treatment of pain and other related problems that comes along as physical, psychosocial, and spiritual. So the WHO has embraced a holistic approach to it. Apart from the physical pain, the psychosocial and also spiritual aspect. Palliative care sometimes is used to describe supportive care when the disease is no longer responding to curative treatment. Prior, this is what used to be considered as the main definition for palliative care, that this is supportive care you give when the patient disease is no longer responding to drugs or is no longer responding to curative treatment. But the other affirmative part is that palliative care affirms life and regards dying as a normal process. And so most facilities mostly provide palliative care at the end of life. However, we need to know that palliative care can be helpful for a person of any stage of illness that is critical, regardless of the age. So you don't think palliative care like geriatrics, where you think this is needed for elderly because they're the ones nearing end of life. No, it could be even at any age. It could be pediatric palliative care, or it could be the geriatric palliative care. So this is not limited to elderly alone. It can also be even for children, provided the person has a critically ill illness that is affecting their life and it is promoting a state of end of life. So the other bit is that Palliative care, therefore, is provided as the main goal of care, and it can be provided in tandem with curative treatment. Nowadays, we are not supposed to wait until the drugs are no longer reacting. That's when we start palliative care. Provided the prognosis of the client is presenting with poor progress and you're worried that it could be worsened, then you are allowed to start the patient on palliative care. So it is an interdisciplinary team which can include physicians, you can work with nurses, occupational therapists, physical therapists, and so on, to just have this teamwork or team support to ensure the patient gets holistic care. So it's provided in different contexts. Some people prefer to be taken care of in hospitals or at patient facilities, nursing homes. Others prefer to be given palliative care while they're in their houses or home-based services. So all these are basic knowledge that you need to know about palliative care. From the fact that it can be a supportive care when the patient disease is no longer responding to curatives, and that you need to know that palliation affirms life and understand that dying is a normal process. Can be given at the end of life, and however it can be started at any stage of the illness, provided that the illness is critical, and it can be at any stage. So the main goal is it can be done together with curative services, and this is implemented by a team or interdisciplinary team composed of doctors, nurses, physiotherapists, and other health-related workers, including social workers. And the settings where this palliative care can be provided, actually it can be anywhere, whatever the patient prefers. It could be in the hospital, it could be the outpatient, it could be in a nursing home or home itself. So it's up to what the patient chooses to work with. And the second concept is hospice. So with hospice, this is a facet of palliative care. It's not a different, as some people use it interchangeably, whereby they refer to hospice to be the same as palliative care. But actually, hospice is a part of palliative care. It was like a child of palliative care. So some people define hospice as a center or an institution that is specialized to offer palliative care and end-of-life care. But we need to appreciate that just like palliative care looks into alleviating pain and symptoms, hospice also looks into the same. So it focuses on care, comfort, and quality of life of a person with serious illnesses who is approaching end of life. And sometimes, may not be possible to cure the serious illness, or a patient may choose not to undergo certain treatment. So the hospice is quite like similar to palliative care, just that there are few provisions that will qualify a client to go into hospice. So it's not the same. So the palliative part of hospice is that hospice care focuses on comfort and psychological support, but curative services are not pursued in hospice. So unlike palliative, where we are saying in palliation or palliative care, we can bring in curative, or we can do it in conjunction, where the patient is getting palliative care at the same time they're being given curative services. But in hospice, curative services are no longer being given, or they're no longer being pursued. And in this case, we are told for someone to qualify for hospice, the individual is supposed to at least have been certified by 2 doctors to have less than 6 months to live, assuming that the disease follows its typical course. So we are told that for you to certify to belong to a hospice service center, then 2 doctors at least needs to ascertain or affirm that the individual has less than 6 months to live, and therefore they can be graduated to be in a hospice facility or to receive hospice services. So you need to note that with hospice services, some people prefer the hospice services to be done also again in a facility or in an institution. Others will prefer to be done at home. So it's not the same for everyone. People may choose where they want to be done for. So understanding this concept of palliative and hospice. So there's a relationship between the disease, the supportive care, and the palliative, what you're calling the continuum of care here. So there's a relationship since the patient gets sick, they start on supportive care and palliative care comes in. So in the old concept, we were told that when a patient will get sick, they will be started on curative management. And then when the curative management fails is when the patient is started on palliative care. and then as they wait for death and bereavement and so on. But now people felt this was not comprehensive enough and it was not meeting the needs of the patient. So there was now more advancement done to have a better concept whereby palliative care could be done concurrently with curative care. So in here we are saying in this aspect, when a person has been diagnosed with a disease and the disease is potentially being treated on cure, there are those symptoms you could look into and suggest supportive or palliative care. And if you look into those symptoms and you can assure the client that can be put on supportive care, then you can run this management concurrently. Now, note under the palliative care, you can also have an input of hospice. And so as this goes in, it can either end up in death, which later brings in what we call bereavement care and management. So prior, it was a linear management. Wait for curative care to fail, then start on palliative care. But the difference now is monitor the disease as it's modifying and see if there's potential to cure. But if there's none, then you can also incorporate supportive and palliative care as the patient goes through their curative care. In aspects where you discover the client might not survive for more than 6 months, then you can graduate them into hospice care, where maybe sometimes they can progress well or they can have cases of unfortunately death, and then the family can be taken through the bereavement care. So this is a clearer photo or picture of the continuum of care. We are talking about disease modifying therapies where the disease has been diagnosed, there are symptoms that are clearly presenting, and the patient is on curative life prolonging, and we are treating this disease in regards to its symptoms. But again, you discover that maybe the prognosis is not that good, so you can have now implementation of palliative care, checking on symptom control, supportive care, and so on. And in here, you can input hospice if maybe you try and see that the lifespan of the patient is less than 6 months. And in this case, can be an outcome of death, which brings in now bereavement care. This is the relationship of how the disease progresses, incorporating palliative care and hospice at the same time. So just to emphasize is that palliative care can be started in tandem with curative care or curative therapies without really waiting until the drugs or the disease is no longer responding to the cure or the curative services. So what's now the difference between palliative care versus hospice care? So palliative care, where we say it's a care that addresses the goals of care and focuses on quality of life. Palliative care focuses on family support. It also focuses on symptom management, and palliative care can begin with the onset of symptoms from a serious life-limiting disease. But on the other side, hospice is a specific type of palliative care. This is what I was trying to explain. Hospice is a type of palliative care. It's not an independent type of care. It's a type of palliative care that is provided when a patient is terminally ill and the life expectancy is less than 6 months if the disease runs its expected course. So what hospice does, it will provide team-based support, to provide services to patient, family, and caregivers in the home or in an institution. So looking at these two, there's palliative care, which is the broader care here that we are discussing. And then in it, we have the hospice, meaning hospice is a component of palliative care. And it can bring comfort. So both of them are targeting comfort by doing symptom management for the patient, family support, and all that. So they have some similarity in them, but they are all working with terminal ill patient. However, in one of it, hospice is that the life expectancy is less than 6 months. So here is a clearer comparative table. So here we have palliative care versus hospice care. What are the comparisons between them? Both of them work together to ensure physical and psychosocial relief for the patient. Both of them are focusing on improving on the quality of life for the patient. Both of them are multidisciplinary team approach, or rather they work together with a team of medical practitioners And on the different side is that the palliative care is physician-led. So the physician is the one that guides this palliative team. But in the hospice care, it's a multidisciplinary team approach, yes, but the nurse is the one leading the team. So it's nurse-driven or nurse-led. Then palliative care can be started at any stage of a disease or age, while hospice is started only when the prognosis of the disease is 6 months or less, or the patient life expectancy has been confirmed that it's going to be 6 months or less. With palliative care, it can be run concurrently with curative treatment, but the hospice care excludes curative management. So I hope you're able to get that difference. Physician-led, nurse-led. Any stage, 6 months or less. Concurrent with curative treatment excludes curative treatment. So that's the main differences. But on the similarity side is that they're all working to ensure quality of life. They all have multidisciplinary approach, and there's targeting of physical and psychosocial relief. So those are the main aspects that you can put into consideration when you wish to understand the differences between palliative care and hospice care. Other concepts in palliative care that you need to know is the word bereavement. And bereavement by term is that it's a total response to a loss and includes process of recovery or healing from loss. So this is a process and it's a response whereby we are looking at healing from an aspect of loss. The other bit is chronic and complex conditions. So these are biological or physical conditions where there is a natural evolution of the condition can significantly impact on a person's overall quality of life, including e.g. irreversible inability to perform basic physical and social functions. So this is how we look at when you're defining a chronic or a complex condition. This is a state whereby the physical condition, where it takes its natural evolution, it can affect a person's overall quality of life, including irreversible inability to perform basic physical functions. Other terms is the dying, and dying, by definition, you can talk about ceasing to be. So dying is the process of passing away from life or the process of ceasing to be. The number 6 is the end of life. So end of life, that part of life where a person is living with and impaired by an eventually fatal condition, even if the prognosis is ambiguous or unknown. So this is a state whereby a person is living with a fatal condition or a condition that has likelihood of leading to death. So that's what you can try to simplify. Seventh concept is end-of-life care. And with end-of-life care, we are referring to healthcare provided in time leading to a person's death. So this is care that you provide to a person in the time that is leading to their death. And it can be given, it could be hours, days, or months before the person dies. And it can be a composition of care and support in regards to the person's mental, emotional, physical, spiritual, and also practical tasks. So this is care that is given to a person in the particular moment that is leading to their death. And this is care that can be provided in terms of hours, days, or months before this person goes. And this could encompass mental care, emotional care, physical comfort, spiritual, and even practicalities. So it's very broad. It's not just curative services that can be given to as end-of-life care. And then the other term that is very important to know is the family. And in palliative care, family is not just biological family here. We refer to anyone who is closest to the patient in terms of knowledge, care, and affection. So anyone who is closest to the patient in knowledge, care, and affection. And this family could be biological. It can also be acquired family. So with biological, we are looking at biological family, sisters, brothers, your mother and aunts, but it could be by acquisition or acquired, either by marriage or contract, or it could be by choice, like friends, or it could be by choice, like pets. All these become family during the the palliative session. And the last bit is holistic as a term. So with holistic, this is an aspect whereby we are looking at our patient as a whole. So holistic is a whole made up of interdependent parts. So you are most likely to hear these parts referred to as mind-body connection. So the holistic aspect in palliative care incorporates spiritual, physical, mental, and emotional aspects, such that when a patient is being catered for, you're being catered for comparating or bringing together all these parts that involves spiritual needs, physical needs, mental, emotional, and also the spiritual needs, so that the person is taken care in completeness and adequately catering for each and every aspect of their health needs. So thank you so much again for staying with me to the end. Remember to subscribe, comment, and share. And till we meet again in our next class, bye bye.